If you're considering hiatal hernia surgery, I really want to talk to you about some aspects of it I think are very important. Now, I'll lead with the fact that I'm not a fan, but that doesn't mean I never think it's a good idea. So I'm not saying that. But, you know, if you were my very best friend or you are a family member of mine, this is what I'd be saying to you if you are contemplating the hiatal hernia surgery. Now, this is excluding the scenario of this is emergency surgery. Half your stomach's above your diaphragm. They're worried that the stomach could die due to torsion, life-threatening. You know, we're excluding ourselves from that. We're talking about the classic small to medium sliding hiatal hernia, which is what we deal with mostly here at the clinic. And there's a lot of issues that we see post-surgery, but this is not slanted. So I did lead with the fact that I'm not a fan, but I'm really doing an objective look here to give you sort of the best possible instruction and enlightenment and just data that you can have. So first of all, let's talk about the size of all of these things. So your esophagus, so that's the tube that connects your mouth to your stomach, its diameter, it's just shy of an inch. It's like 0.97 inches. So call it an inch, it's basically there. And then at the bottom of your esophagus, of course, it then joins to your stomach. So that joining, they call it the gastroesophageal junction. Gastro just means stomach. So it's just where the two join. That is anywhere from 4/10 of an inch to 8/10 of an inch wider. So when we're talking about a sliding hiatal hernia that's not in the oh my gosh, you know, a chunk of your stomach is above your diaphragm mode, that's what we're talking about. We're talking about that junction is pushing up above the diaphragm. So you're talking about 4/10 of an inch to 8/10 of an inch. So the whole increased opening is anywhere from 1.3 inches to 1.7 inches. So we went from just shy of an inch, 0.97, to a normal esophagus to 1.3 to 1.7 inches. So that's how much the opening has widened. And I think that's very key to know, because when we hear about, you know, that we have a hiatal hernia, it's like, oh my gosh, my stomach's in my chest. And, you know, I hear a lot of people describe it that way. And for the vast majority of people, it's not that dramatic. I'm not saying it's not a problem. It is. It's not normal. But we're not talking about this gaping hole in, you know, of your diaphragm with your, you know, this organ into your chest. It's when it gets to that point, there's no argument that surgery is the right thing to do. So I just wanted to sort of give some numbers to start.